Hello, everyone, and welcome to today's event, which is the future of teleservices in treatment courts. And this is part 2 of a virtual learning community hosted by SAMHSA's GAIN Center with the support of SAMHSA, which is the Substance Abuse and Mental Health Services Administration. Today, we will be focusing on planning for teleservices, assessing needs, and identifying opportunities. I'm Erica Ihara, and I am a project associate with SAMHSA's GAIN Center and Policy Research Associates. And I have a couple of housekeeping items to cover before we move into the presentations. First, the views, opinions, and content expressed in this presentation and discussion do not necessarily reflect the views, opinions, or policies of the Center for Mental Health Services, the Center for Substance Abuse Treatment, the Substance Abuse and Mental Health Services Administration, or the U.S. Department of Health and Human Services. If you have any questions for the presenters or in regards to the technology, there is a Q&A box to the right of your screen, and we ask that you please feel free to enter your questions throughout today's event. We will be queuing up those questions for the second hour of today's virtual learning community, and we will be addressing as many questions as time permits. Also, some of you had submitted some questions at the time of registration, and we also have collected those, and we will be addressing as many of those as we are able today as well. We also will be conducting a couple of polls, and we really appreciate your participation in those. So if you see a poll pop up on your screen, and if you would like to participate, we always appreciate the feedback. This webinar is being recorded, and slides will be disseminated via the GAIN's listserv following the webinar. We will also notify you when the webinar recording is posted to SAMHSA's YouTube channel. And finally, a certificate of attendance will be available for download at the end of the webinar before the discussion group begins. And just a reminder to everyone in the audience, this certificate is for your personal portfolio use only. It is not for continuing education credits. We have ASL interpreters for this meeting, and our 2 interpreters for today are Jim Brown and Marika Larson. And for best visibility, we recommend that you go to the layout in the upper right-hand corner of your screen and select Hide Non-Video Participants, and then change the layout view to full screen. And you should be able to see the interpreters up at the top of your screen. Finally, select View All. We also have live captioning for this event. And to view this, select the Accept button in the Multimedia pod, which is located in the lower portion of your screen on the right side. And the color contrast of the caption pod can be changed as needed, and we recommend high contrast for best visibility. So today, we would like to welcome you to part 2 of the 3-part virtual learning community series. Next slide, please. And here is the agenda for today. So after I complete the housekeeping portion, I will be turning it over to Mr. John Berg, who will give some comments on behalf of SAMHSA, and then the presentations will follow. And so now I would like to turn this over to John Berg. He is Senior Public Health Advisor at the Center for Substance Abuse Treatment at SAMHSA. John?
Thank you, Erica. And welcome to everyone for today's virtual learning community, the future of teleservices and drug courts. As Erica said, this is part 2, planning for teleservices, assessing needs and identifying opportunities. We appreciate you taking time out of your busy schedules to participate today. Unfortunately, the opioid crisis continues to be a public health crisis with devastating consequences, including increases in opioid misuse and related overdoses. The COVID-19 pandemic continues to negatively impact drug court programs and their ability to serve clients. While treatment drug court programs had to incorporate technology and teleservices into programming during COVID-19, implementation barriers are a common occurrence, and staff are looking to the future to determine best use of teleservices beyond the pandemic. SAMHSA is interested in promoting policies and practices to lower the risk of overdose for persons with opioid use disorder who are or have been in contact with the criminal justice systems. We're also invested in assisting drug courts and other criminal justice related programs, such as reentry programs, to deliver services more effectively to participants in these programs. As we learned over the past months, teleservices is a promising practice to positively impact the field by increasing the capacity of the justice system to respond to these two crises. The effective use of teleservices increases access to medication-assisted treatment to reduce opioid relapse and overdose, and assist drug courts and reentry programs to develop more efficient service delivery to program participants. Treatment courts across the country had to quickly adapt to COVID-19 guidance and restrictions, building quickly upon lessons learned from previous implementation efforts. Although much of this workforce continues to operate remotely today, treatment court practitioners are now beginning to contemplate strategic directions for a post-pandemic service model. Part 2 of this 3-part virtual learning community will review the many considerations for treatment court practitioners to address as they plan for adoption or more permanent expansion of teleservices, including assessment of organizational readiness and fit, assessment of client readiness and fit, and staff and client training needs. Our goal today is to provide practitioners with a comprehensive strategy for building a strong foundation for teleservices. We're excited today to host this VLC with 5 experts in the criminal justice field: Sheila McCarthy, Karen Otis, Karis Myrick, Dr. Michael Chappell, and Victor Vasquez III. I would also like to thank the Gain Center, as always, and their staff for their work in developing and facilitating this VLC. So at this time, I'll turn it back to you, Erica.
Thank you, John. And now it is my pleasure to introduce our panel to the audience. So here we go. Sheila McCarthy is Senior Program Manager of National Technical Assistance at the Center for Court Innovation, and she specializes in teleservices initiatives. Prior to her role at the Center for Court Innovation, she worked in the New York City family courts for over a decade. Karen Otis is Associate Director of Treatment Court Programs, Training and Technical Assistance Department at the Center for Court Innovation. She is a statewide training and technical assistance provider for the Bureau of Justice Assistance, and in that capacity works directly with administrators, statewide coordinators, and stakeholders to support and maintain treatment court fidelity. And she has worked in family treatment courts for 12 years, and she also maintains a psychotherapy private practice. Karis Myrick is co-director of the Strategic Impact Initiative for Mental Health, which is housed at the JED Foundation, and she is a board member and policy liaison for the National Association of Peer Supporters and an advisor for the American Psychiatric Association's App Advisor Work Group. Ms. Myrick worked previously for the Los Angeles Department of Mental Health as Chief of Peer and Allied Health Professionals, and she also worked at SAMHSA Center for Mental Health Services as the Director of the Office of Consumer Affairs. Dr. Michael Chappell is Assistant Professor of Clinical Psychiatry at the New York State Psychiatric Institute at Columbia University. He leads SAMHSA training and technical assistance initiatives for HHS Region 2, which includes the Addiction Technology Transfer Center and also the Opioid Response Network. Victor Vasquez is Director of the Webb County Court at Law DWI program in Webb County, Texas, and prior to becoming director, he served as a case manager for the DWI court. So before I turn it over to Ms. McCarthy to begin the presentations, I just wanted to share some observations about who is out in the audience today, and thank you all to everyone who participated in the survey. So most of you are calling from urban areas today, and followed by rural, and then followed by suburban is the smallest group this morning and this afternoon. Many of you are calling from the judiciary and probation and parole, corrections. We have people from community-based organizations and people from government, and a couple of you who marked other. So welcome to everyone. Thank you so much for taking time out of your day to join us for this discussion. And I am going to turn it over to Sheila McCarthy to begin the presentations. Sheila?
Thanks so much, Erica. Hi, everyone. I'm really excited to be back here for a second session on teleservices, today focusing on assessing organizational readiness for teleservices. Just really quick, for those of you that are not familiar with what we do at the Center for Court Innovation, we are a justice reform nonprofit that focuses on reducing crime, aiding victims, strengthening communities, and improving trust in the justice system. And our main mission is to make the justice system both more humane and effective for those that are involved. And we do this in three main areas: through conducting research. We start operating projects like community courts, which we have in New York City and in the New Jersey area, and providing expert assistance through our training and technical assistance team, which I am a part of, as well as my amazing coworker, Karen Otis, who you will be hearing from after me. And our team really provides expert assistance in many forms, depending on who we're working with, but we do a lot of help planning, implementing, and evaluating new policies, practices, and technologies. The center has a ton of different publications. These are a few that are specifically focused on technology that I'd encourage you to check out. When you get the PowerPoint, they're obviously embedded in here. They're also available all on our website at courtinnovation.org. Some of them go into more in-depth as far as planning for teleservices. We also have a more recent publication on COVID-19 and how treatment courts were able to stay engaged with participants when the pandemic began. And just a really quick note on language. I can tell you teleservices was settled upon by the center many years ago because we wanted it to be clear that we're talking about telehealth and telemedicine, yes, but also more than that. And so for treatment court professionals, we really see this as an umbrella term for these three separate ideas of treatment monitoring and treatment monitoring, supervision, and training, which, you know, here we are today doing another virtual training. And so even though the regulations have been lifted or become a lot more lax in this last year with regard to telehealth and virtual court operations and everything else, it's really important that, you know, we still try to maintain at all times as much as possible everything involving HIPAA, measures of consent, confidentiality. And so I really urge you to keep these principles in mind when you're determining your readiness for more of this long-term planning and what would be potentially helpful for your jurisdictions. So first and foremost, technology should be humane. You know, you want to make sure that you're making technology as comfortable, minimally intrusive, and non-stigmatizing. You want to make sure that you're ensuring technology is adding to the quality of life rather than diminishing it. And that also goes into technology being inclusive. So make sure you're considering different languages, different abilities, different levels of technical and language literacy, and just also to the specific access to technology itself, so you're not creating more disparities within your communities. One thing that's really important is that it should be implemented with true consent. I understand that when COVID happened and that it was just everything's virtual and that consent piece was not there, it's really important when you're thinking about going forward that you are receiving the consent from the participant and that, you know, technology is explained to court-involved users using simple language, ideally in multiple formats. You know, we all learn differently. Some are better visual learners versus having something in writing versus just sitting there with their phone maybe and walking through step by step and really detailing the impact on technology in that person's life. And a big one is technology should solve problems rather than a solution in search of a problem. So if you don't need to use technology, if you're just saying, oh, we can, but maybe it's not the most appropriate place, keep that in mind. It should always achieve its objectives in the simplest and least intrusive ways possible. Sustainability is a big one. Technology, we all know, needs frequent maintenance. A lot of times that's overlooked when you're like, oh, we got the money for this. So what are you going to do next year? And that's everything from the technology itself to the platforms, to paying for licenses, you know, whether it's a Zoom account, WebEx, all of these things. You might have something for a year, but what's going to happen then? So really building those into your plan when you're determining the readiness for what could work in your courts. If you're working with specific vendors for gamification or other types of platforms, looking in to see, you know, is what their vision is aligned with what yours is, because that might come up as far as when you're planning and some of the different options that are available. And normally when we do teleservices planning, we really urge jurisdictions to start small. Start with pilot sites, test ideas out, see what happens in one area and what could be applicable. And so even though you've been doing stuff for the last year and a half, really just kind of going back to the basics to see, are we testing these things out? Just don't assume that something's going to work because it might have been in certain scenarios. Really make it a thoughtful process. Also having everybody have a realistic understanding of what a technology solution does and does not. That really goes into bringing all those stakeholders to the table to come to decisions together so that everybody has a shared understanding of how this is going to support and enhance what is currently happening. And the last one, I think this one is the most important, be prepared to pivot. When you find that a technology is not achieving its objectives or fulfilling, all these principles that are listed here, or if it's creating a new problem, take a step back and reassess. Just because you have something doesn't mean you need to keep it, the same way forever. And so as needs change or as new ones surface, be prepared to pivot to new technology or non-technology solutions. Virtual everything was never meant to be and shouldn't be the default. And so I think, in the last year and a half, we realized, yes, technology is an amazing tool and how great it has been that we can still have these connections, but also realizing the importance of how great it is to be in person with one another and that human connection makes a big difference. And so again, just thinking, just because you can do something virtually doesn't mean that you should. There's really a lot of considerations to think about. And I mean, none of these are going to be new to anybody, but these are some of the benefits that we already know from teleservices as far as providing a broader client reach, expanding the arsenal of services that you have in your community. We know often there's certain services that can be limited. Saves travel time and money. You don't necessarily have to worry about that transportation piece from getting a participant to point A to point B, but there still can be cost involved. So kind of weighing all these factors and seeing what works. And I'll probably say this like 3 times because I do it in every presentation, but teleservices is not meant to replace other practices that are working and work well in person. It's to enhance where there are service gaps and use it as an incentive and phase advancements and different things like that. And I'm not going to go through this list. I'm sure a lot of you are familiar with a lot of these and have been doing them, but just keeping in mind in alignment with whatever your state and local directives are, using technology for some of these opportunities. And I'm going to talk about a needs assessment process, but thinking about all of these areas and any gaps where the technology might be able to fill some of these and possibilities for supplementing and improving access. Look at some of these things that might have worked better in the last year. Because you were able to have more input from the larger group that aren't necessarily able to get there in person every time. And so thinking about some of those pieces when you're looking at, what is the readiness for your process and going forward. And also keep in mind, what are some of the potential barriers? And so the first, of course, being cost and access to technology itself. We all know that a lot of time those upfront expenses could include developing more softwares and licensing and investing in a secure broadband connection, which can be a big upfront cost. But it also could include purchasing personal equipment for participants that don't have them. You want to make sure that if you're going to, start implementing teleservices, that participants have or tablets or help paying some of their bills, whatever that looks like. If you're talking about having participants wear biometric devices, how are you going to not just cover those upfront fees but the ongoing fees? And I know in the last year a lot of states were able to either tap into emergency federal money that was available for technology or state funds. But what's going to happen next year? Is this something that's going to be built into your state budget, or is this something that you're going to have to deal with every year for some of these fees? It's also another opportunity when you're talking about stakeholders coming together. Are you able to potentially, partner with a nonprofit in your community that's also able to cover some of these expenses? So really keeping all of these things in mind when you're looking about long-term. Regulatory issues. Federal and state regs, of course, have been lax, but we know that that's changing on a daily basis, especially on the state level. I can say that even in New York State, the governor lifted last week all of the emergency allowances that we're allowed to have a lot of things, not just the court appearance and other things, but there are a few counties in New York State that pre-COVID were not able to do any virtual court appearances. So when that ban got lifted last week, all of a sudden now they have to shift to immediately back in person. And how are they dealing with that? Still with the other restrictions. And so it's just another example of just having to pivot when a lot of these regs potentially go back to what they were before, or just how you're going to make them adaptable to what's happening now. Again, insurance coverage, a lot of these things we're going to have to wait until there's some federal messaging, but just being prepared that some of the things that are in place now aren't necessarily going to be in place in the future due to some of the restrictions. User comfort and experience with technology. You want to make sure that there's training and ongoing support for anybody that's using it, and that goes from the participant to the judge engaging on the bench, to the treatment court staff, to the treatment providers, probation, anybody that's involved, really doing that check for the support, and then also going to the next one as far as quality control. And with that, also looking into user confidentiality, data security, participant accountability, depending on what you're using it for. Fidelity to evidence-based practices. It's not always clear whether the remote delivery is exactly the same, if it was meant to be done remotely or not. And that's because there's different options, of course. Sometimes it's live doing an intervention, sometimes it's computer-based. So really looking into the fidelity of these models to see if the user is getting the same experience that they would if they were in person. And a really important one is legal and privacy issues. So when you're talking about the court piece, how is that individual going to have access to legal counsel when they're not standing right next to their lawyer? What is the plan for that? If somebody wants to challenge the results of a remote drug test, how is that going to be dealt with? And then a big one is the legal consequence of a defendant if, are they going to get charged with failing to appear because they had technical difficulties? What is your plan, and the consequences for all of these pieces are really things you want to keep in mind. And, I think I said already, but normally when we do teleservices planning, it can be anywhere from 6 months to even a year, depending on what they're looking to put into place. But I think it's really important that you take all these considerations and really go through and do a needs assessment and step-by-step to see what will potentially work for everybody that's involved in your treatment court. And so first, evaluating the need for teleservices in your treatment court in those 3 main key areas. So when you're looking at treatment, looking at the needs of your clients and the range of supportive services that they need based on whatever their recovery path is that they've chosen. So what are currently the gaps in services, or what were the gaps in services pre-COVID that you've been able to use technology to enhance and get those people the services that they need? A lot of times we hear, oh, we have like a lack of qualified trauma counseling, or we don't have culturally relevant services for an individual. Instead of just sending them to the 1 or 2 providers that are in your community, think outside the box a little bit more to really make these treatment plans the individualized and getting the most appropriate treatment, and that's going to be most helpful for that participant. Compliance monitoring. On the June 16th session, I went through opportunities to enhance through each of the best practices through technology, and figuring out some of those remote monitoring techniques that actually might be really helpful going forward, instead of having, again, another time where that individual has to come for another appointment to the courthouse or to probation, multiple times a week and things like that based on their situation. And also the professional development piece. I mean, I know that we're all really excited to go back for in-person trainings. I am, especially. But a lot of times, the cost for that and the amount of days out of the office and all of those things are going to prevent it from happening as much as we all would like anyways. And so considering, some technology, some supports that might be able to supplement some of that. I know that we've had some states that, now they have quarterly meetings with their coordinators on Zoom or whatever platform, just to be able to get a little bit more in-person contact with some of the individuals that we really only get an opportunity to see maybe once or twice a year. And then as far as identifying and choosing specific treatment interventions and other, services that can be offered remotely, I think one of the biggest things that expanded in this last year are the number of recovery apps and online meetings that are out there. And again, this is going to be up to the individual, but we've heard feedback that some people are actually more engaged and prefer some of these online options instead of going in person, especially in potentially a rural area where they don't want to go to the one support group that's in their area where they know everybody, or you're looking for a specialized type of meeting that's just not offered, or the hours just don't work with what your schedule is. And so I think if nothing else, it's another opportunity for when you're doing whatever your continuum of care is just to give this as another option to individuals. Some people aren't going to want to do online any of this, and they shouldn't be forced to do so. But for people where this might be a really good recovery support and to be able to build a different type of community, it's a really great option to have when you're going through all of the different things. Assessing the technology, again, considering that hardware, the software, the broadband. What is the broadband in your area? We know that's a huge problem in a lot of places in the country. Some places you just don't even have that cell phone service and Wi-Fi access. And so what are you doing to ameliorate some of those issues? Again, the cost of implementing the project and sustainability, I went into a little bit before, but keeping that in mind, whether that means, getting it more in a permanent budget, or is this something where you can look for outside funding to be able to supplement? I mentioned the importance of building necessary partnerships. And so engaging with those key partners as early as possible in the planning process to ensure that their concerns and needs are met. You want every role at the table when you're creating these guidelines and policies and procedures. And when you're involving stakeholders early in the process, that can also help generate buy-in. And it can also help deal with some of those potential ongoing funding where somebody at the table says, well, do you know whatever agency in the community actually has money for this? I can say that when we were building protocols pre-COVID as far as court appearances, making sure that the defense was there to express their concerns, as well as the prosecutor, as well as the judge, the clerk in the courtroom, and how they were going to be dealing with all of these things. It's really important to make sure everybody's at the table, able to express their views and come to a consensus on what potentially could work. Identifying the end users of the technology, and again, just addressing their comfort. Everybody has consideration to each individual's training needs. Also with that, you want to make sure that you have a mechanism to collect data. You're really only going to see the impact when you start collecting data and see, the times are improving from when somebody was assessed for treatment and when they're actually starting. Are you able to have the judge actually have more contact with the individuals, even if it's not in person, it's being supplemented by video. And this is also a way where if you're looking at something as negatively impacting your court, you then can pivot what you're doing to make sure that it's not having a negative impact, it's having a positive impact on your operations, as well as what the participants' views are. That is really important as well. And again, identifying the locations where, any type of remote operations are going to take place, making sure that you're considering factors like privacy requirements, supervision needs, existing technology capacity at each potential site. If you're having individuals that are appearing remotely for a court appearance from some type of residential facility, who's actually gone to that facility to actually do a site visit and see the space? Are they actually in a confidential room? Are there headphones available? Is there a phone? What is the backup plan if the connection is lost? You want to make sure it's not just the treatment provider that's saying that, it's somebody from the planning process. And that's the same for the court piece as well. You really want to make sure that you're being really thoughtful as far as where individuals are appearing, and that they have all of the same measures that they would have if they were in person for any of these. And again, just exploring and addressing any regulatory barriers for any of the reasons that I've mentioned previously. And I'm not going to go through all these. You'll have them in the slide deck, but this is some information from a lit review and looking at the impacts of the use of video in court. And pre-COVID, there wasn't really a ton of research out there as far as the impacts, specifically on problem-solving courts. But what we do know specifically is that when somebody's liberty is at stake, it has been very detrimental for an individual to not be in person. And so again, when you're figuring out which appearances, what types of cases, all of these things, you really want to go through it step by step and see the literature review that's out there. On the last session, Tara Kunkel was shared her recent survey, and I know that Shannon Carey has as well, as far as participant feedback. And so I think that's one sort of silver lining, is that hopefully after this, we will have a lot more of the actual user feedback. And then I think maybe in the next couple of years to see how things are implemented longer term, when it's not the only, virtual is not the only way that people are interacting, but just to get a little bit of a comparison and see how we're able to shift things for the new business as usual as we move forward. I know I talk really quick, but there was a lot to cover in 20 minutes. So I will be on at the end for anybody that has questions for the second hour, and I'm going to turn it over to my amazing colleague, Karen Otis.
Thank you, Sheila. Sheila's amazing as well. And Sheila actually covered a lot of stuff that I'm going to talk about when it comes to assessment, but from the client perspective. So as Sheila mentioned, Sheila and I work together at the center, and we both provide teleservices, strategic planning, and TTA. And prior to COVID, we worked with courts that were interested in teleservices, and most of those courts were in rural and frontier jurisdictions. Those courts wanted to serve more clients and wanted to give more access, and technology was the answer to that question. However, recognizing the value of technology didn't always result in the development of a teleservices plan. But the number of courts that did, the jurisdictions that did, the success of the program really hinged on what we're talking about today is readiness. The program readiness that Sheila talked about and the client readiness that I'm going to talk about. So I'm going to share some elements that we found that are really important when developing a client assessment, client readiness assessment. So what is a client readiness assessment? It basically is the initial needs assessment that we engage our clients in when we're identifying that teleservices needs for them. But before we discuss those individual elements, I want to really talk about client engagement in general and the practices that we use to engage clients and how we can support our clients in these initiatives, whether it be teleservices or in-person engagement. So let's examine some client engagement. We should embrace the following client engagement practices. Developing individualized treatment plans. That's really important for all of our clients. Individualized treatment plans ensure that clients' needs are met to prevent the one-size-fits-all approach in service planning. That tends to be the catch-all where everything is thrown at the client without truly individualizing their plan to address their needs. And then the client is overwhelmed and has too many things they're trying to manage, and then can cause harm eventually because they can't process through and then are penalized for not being able to achieve the one-size-fits-all treatment plan. Additionally, since we work with diverse populations, we need to prioritize, identify, and address racial and ethnic disparities in our programs to ensure that we are giving equitable access to services and treatment. We want to embed the 4 procedural justice fairness principles of understanding, neutrality, voice, and respect, and for all of our client engagements so that the clients are informed and understand every phase of the program from intake to aftercare, that the court and its processes are neutral, that the clients have a voice in all of the process and the proceedings, and that clients are respected throughout the court process. Additionally, we want to use motivational interviewing when we include clients in the treatment plan and goal setting process. When we include clients in their process, and I really want to stress this is their process, we're empowering them to be more self-determinant. They know their needs, and the more collaborative the treatment planning process is, the more engaged the client will be. Also, we need to include appropriate treatment interventions, as Sheila mentioned. The intervention should be culturally appropriate, gender responsive, based in cognitive behavioral therapy with a trauma-informed focus. Having these types of interventions available to clients will ensure the treatment plan is individualized because every client will not need trauma, every client will not need gender responsive, every client will not need culturally appropriate services, but having them allows you to target those clients who do need those. In addition, we should review our policies and procedures to ensure that we don't exacerbate disparities, that we promote client collaboration, and that we give clients a voice. Appropriate client engagement will lead to client empowerment, client self-efficacy, client self-determination, and client recovery. So throughout the pandemic, we couldn't use our traditional supervision and monitoring methods. As treatment court providers, we tend to rely heavily on supervision and monitoring. And so we weren't able to do that because we didn't have access to our clients. So we had to rethink our processes. And teleservices was clearly a part of that rethinking of the processes in every jurisdiction. And now that we've had to embrace teleservices, lots of jurisdictions are trying to figure out how and in what capacity teleservices can be kept in the programming. No matter what courts decide they're going to keep, COVID-19 did not allow us to adequately assess a client's readiness, as Sheila had mentioned earlier. So going forward, to ensure a client's success with teleservices, an appropriate assessment is necessary. And when developing a client readiness assessment, practitioners should develop a tool that determines the following. It should identify client need and interest. It should identify client proficiency and access to equipment. It should identify client access to internet and broadband and their accessibility to privacy. And these are some of the same issues that the program needs to consider, but we need to consider them from the client's perspective and talk to the client about how these areas impact them. And we're going to go over each of them individually. So as we talked a lot about COVID, because that is what we're still in the midst of, we all had to pivot, our clients had to pivot, and our clients had to pivot to use technology for treatment, supervision, and monitoring and recovery supports. And some courts are up and running now, and if they're up and running, some of the clients are returning to in-person work, and they don't need to rely on technology in the same way. While other clients, those that who are employed, who are in training, who are in education, trying to get education skills, or who have childcare and transportation issues, those clients should be considered for ongoing teleservices and have their needs assessed and their interest in continuing the teleservices work. This will allow those clients the opportunity to continue to actively participate in all of their recovery supports and treatment programs that's available to them without negatively impacting their employment, their education, or their familial responsibilities. And additionally, Sheila mentioned that teleservices can be used as an incentive or phase advancement. And this should be really considered for clients who are progressing through your program, because we're asking them to change their lives, get employed, attend training, all of these things. And we should have a mechanism to be able to adjust the programming when they are employed, and teleservices is a great option. So if that phase advancement, we should ask the clients or assess the client if they're interested in teleservices. What role can teleservices play in their continued recovery supports? So if clients can attend treatment, case management, court hearings remotely, that will help them in their daily lives. We should consider that. Additionally, if clients can be switched to patches and smartphone breathalyzers as testing methods, that should be considered as well. So the readiness assessment should also identify a client's comfortability with technology, really how they feel about using technology. If there's a difference between using it and knowing it and enjoying it versus just being kind of against using technologies. You can know it and use it, but not enjoy it. And part of it is it needs to be comfortable for a client to use. We also need to know their technological skills and their ability and knowledge of computers, smartphones, tablets, and apps. Also, we want to assess to inquire about their reading level, because we need to know if they're doing an online intervention that requires a lot of reading, you want to make sure that that intervention is an appropriate reading level for our clients. And ask about training needs. What does a client need to know? We should not have any intervention, whether it be equipment or apps or online interventions, assigned to a client in teleservices until they are fully and adequately trained. And so that takes us to client access to appropriate equipment. We know, and we've all experienced in this COVID area, that if you have older equipment with poor broadband, you're not going to have a good experience when you're accessing online services. And even when you have good equipment and good broadband or internet, sometimes technology just doesn't work for us. So we need to make sure that their ability to stay connected is fully engaged. So identifying equipment needs and or other device needs is really important. And when I say other device needs, I mean headphones, maybe a webcam, hotspots, etc. Anything that will make the process easier for the client. And during that assessment, we can let you know that the program can make a decision on if they want to develop a equipment assistance program and what needs to be purchased. You know, lots of courts, as Sheila had mentioned, across the country due to COVID, were able to purchase equipment for clients. And that may be something you want to continue. So budgeting for that to ensure that the clients have all the equipment they need is really important. And that also can be any of the services or the online interventions as well. So this leads to access to internet and broadband. And the same way you want to check the programs, internet and access and broadband, the community, it's the same thing you want to assess that for our clients. Are the clients do they have secure internet at home? Do they have to go to the community? If they do have to go to the community, where is it? Is it a secure location? Because if a client doesn't have a secure internet at home, and they have to log in various places, whether it be in the car, in a library, a local provider, a lot of clients at Starbucks. The clients need to know and be mindful of the pitfalls of logging into an unsecure Wi-Fi and the potential security breaches that can occur when they're doing so. And then additionally, clients need to be assessed for privacy concerns in the community and at home. Sheila mentioned just a little bit about having the program staff go to different places that a client, specifically residential, that might be accessing online services or the court. So you want to assess for that environment to see if there's someone there in that environment that could be an earshot of that client. Does the client have the ability to have a private space with a door, whether it be at home or in the community? And if not, how do we ensure that the client isn't being overheard? Also, assess for expectations, etiquette, and engagement. Policies and procedures should be developed with the client input to ensure clients understand the court's etiquette and expectations. A few examples of this: that the court may want all cameras on during court hearings. The court may say no smoking while you're on camera. No laying in your bed, no radios or TVs in the background playing while you're before the court. That you must remain on mute until your individual case is called. And all of these are actual examples of what we experienced during COVID and stories that we heard. So making sure that any etiquette requirements and or expectations are clear when you are discussing with the client for the potential of being a teleservices client. But we also need the input of the client. It is important to develop our policies and procedures and make sure that the client input is involved to ensure that the program understands the client's needs when using technology. And so once we have assessed the client for the initial readiness and the client is engaged in teleservices initiatives, we need to periodically reassess clients to identify any changes in their teleservices needs or their teleservices treatment plan. Does the client still need a remote option? Has their treatment needs changed? Is the client progressing with the remote services, which is really important? Should they continue with teleservices? Should the intensity increase on teleservices or be reduced? Has their equipment or Wi-Fi needs changed? Are they still employed? Can they still afford Wi-Fi at home? Are there new privacy concerns, like a partner is added to their home or a family member moves in with them, and so the client does not have the privacy that he or she used to have? Are their supervision or monitoring needs being addressed remotely? Should their supervision and monitoring needs be readdressed remotely? These are all considerations during reassess when you reassess a client. So developing a survey or feedback loop with clients to share their experiences, challenges, and successes with teleservices will assist in the program modifications, but it will also support the data collection efforts that the court should have when it comes to tracking the success of the any teleservices initiative that Sheila mentioned earlier. So that is an overview of what a readiness assessment is for our clients what should be included in your readiness assessment, and how to move forward with the readiness assessment and the reassessment process. So I thank you for your time and attention, and hopefully these elements will be helpful when you're developing your own readiness assessment tool for your clients. And I'm going to turn it over to Myrick. Karis, over to you.
Okay, great. Hi, everyone. Thank you so much. I hope everyone can hear me. Also, for the interpreters, my sign name is Karis, so that's who I am. And I'm going to be talking today about training for teleservices and using people with lived experience to develop digital health literacy, to develop the training and curriculum, and also to deliver that training and curriculum. So I think we've talked a little bit about this before, but just to give you kind of a sense of understanding who has access to technology and of technology, we can kind of start to believe that technology is ubiquitous. Like, oh, look at all these people who have access to internet or broadband, et cetera, use mobile phones, tablets. We can see the rise over the years. One of the ways, and I think we talked a little bit about understanding some of the disparities, and this is disparities just looking at age and what folks have access to. So, and what's the difference between what may be in a private clinic where people may be more affluent, if you will, and have access to different types of technology versus the percentage of people at certain ages in the public mental health or state clinic. And so it's much lower for things like having access to Wi-Fi, phone, and then downloading, using apps, even downloading apps and then using apps. So when I talk about teleservices, I also really want to make sure that we're covering things like the use of apps, because a lot of times when people are introduced to this idea of using technology in their recovery, it opens up a world of lots of things that technology can do for their recovery, including use of apps and downloading apps, joining social networking groups, et cetera, beyond what they may be doing in the clinical or a program setting. So the barriers that we have found, especially for people with lived experience, is concerns about data privacy. So we see a lot of things in the popular press, especially around mental health and the types of technology that's being developed for mental health, which are, AI, using a lot of AI to start doing prediction around whether a person has symptoms that may need more intervention or more support. And when we were actually doing some implementation of technology in California, it was really interesting to hear how the consumer movement or people with lived experience of mental health and substance use disorders were interpreting the information about AI or predictive technologies in our field. And their biggest fear was, well, what if we're not doing well and suddenly the police show up at our door because, the AI has predicted that we're not really doing well. And, is there any science behind it? Is there enough evidence behind it? What other things happen? Who owns the data? So there were lots and lots of questions around who owns the data, who has access to the data, and basically wanting transparency over how is this data used. So there wasn't a lot of explanation around what does the technology do, what are the algorithms, and then how do we know that the algorithms are really producing the information that is helpful to the person as well as possibly to their treatment team. And they had put out some press of their own around some of the pitfalls of using AI in this kind of surveillance, if you will. So one of the things that we wanted to look at was really understanding, well, who was using apps and how are they using these apps? And what we did is we actually had a peer-run organization do some surveys of the community. So it was people within the community, as well as people who were in mental health and substance use care, to double check who was using apps and across what age. And then we were also looking across demographics. We wanted to make sure that also we were covering, up to older adults. But as we got to older adults above 50, the numbers got smaller, but we did have enough information about older adults and what some of their needs were relative to using technology. Because this was done in Los Angeles, we also wanted to understand the demographics and make sure that we were receiving enough information from a broad swath of folks. So the survey was done both in English and Spanish. It was done paper pencil, as well as allowing people to complete the survey online, so that if people didn't have access to technology, they still were able to tell us a little bit about their interest possibly in using technology. So the other thing that we talked about in the survey was, well, would you use technology to talk about mental health? Now, this could be the same thing for substance use disorders or co-occurring disorders, to figure out, well, would you even want to use technology for these kind of things? And how would you want to use it? Would it be text messages, phone chat, an app chat, or no, not even interested? And it was really interesting because there was such a push for using AI, yet everybody, it was the lowest rated as far as people having interest in using that kind of application. The highest was mindfulness kind of activities and tracking anxiety or symptoms like anxiety, tracking mood, etc. So after we went out and did this survey, we really wanted to, we really had a better understanding of, number one, what people had access to, that there was a digital divide as far as looking at, did people have access to broadband, Wi-Fi, sorry about the noise. Sorry about that. Technology, what did they have access to as far as Wi-Fi? Did they have access to a phone? Was it a smartphone or was it a flip phone? Tablets and computers. And if they didn't have access to that, were they still interested in learning more about using technology for their mental health and well-being, or their overall behavioral health and well-being? And so what interestingly we found out was that even if people did have access, sometimes they didn't even have the basic understanding of how to use the technology they had. So we basically had to start at ground zero, which was fine. Again, we're understanding the technology is ubiquitous. We know how to use it in our work. We're using it for all sorts of things, but the people we were serving actually weren't. And what they had told us was some of them did not even know how to set up their email account. Some of them didn't, their interest was in, I'm missing appointments. I have a calendar on my phone, but I don't even know how to use the calendar on my phone. So in order to help people utilize the technology in ways that would help them in their overall well-being, it wasn't always about using some of the traditional services as far as like telehealth, connecting to telehealth, or using a mood tracking app. The first thing they had to do is figure out, well, how do I do my email? So we created a digital health literacy curriculum. It was based off of and done in partnership or support from Harvard BIDMC, which is the Beth Israel Department of Medical School program, their digital psychiatry program. They have a program called Doors, in which they have a similar digital health literacy curriculum. Ours, however, was developed for and by peers based on what the people we serve said they needed. So we started off using a digital health literacy curriculum, started off with the basics of email setup and maintaining your computer, your mobile device, etc., and also providing definitions of all of this stuff. The other area, because people had to download apps in order to use some of the things that, we wanted people to connect to, like their EHR, their electronic health record, and or to connect with telehealth, they did have to download apps. So we also had to help people understand how to do that. They thought, oh, I have to have a credit card in order to get on the App Store and download an app, when in fact that isn't true. So we actually started with some basics about how to download and use apps. And that's really great. We want people using apps, but let me go back one, sorry. The other thing that we also wanted to make sure is that people understood, how do they even think about what app might they use? There's not a lot of evidence yet in sort of the marketplace around apps and how they're used to help people in their overall mental health or substance use well-being. There are only, I believe, 1 or 2 FDA approved apps for substance use disorder. There are no FDA approved apps for mental health. But again, there may be things that may be helpful for people for a period of time that they would identify, like mood tracking apps or anxiety, sleep apps. A lot of people wanted to create hope boxes, and they didn't understand how to take their pictures. They would take pictures or write little notes to themselves and how to put that in a file that called the hope box that they could easily access. The other thing, again, that people were really bringing up is, how to be safe. So, and what does that mean around their digital footprint? How can they think about their own safety? How can they think about their own privacy? And what do they have control over in that regards? How to select a password and remember that password so they're not sitting at some place where somebody else can get access to. So we, again, provided some training on this. And again, these are peers training service recipients. And also the peers trained other peers because, LA County is 10 million people. It's a pretty big county. So we had to train other peers, and then those peers would work with the people they're serving. And it's great to have curriculum. Everybody wants things manualized. And so we did manualize the curriculum. It was at the 6th grade level. People said it would really help us if we had it at the 3rd grade level, but we actually kept it at the 6th grade level and then made sure people had access to dictionaries or other TA to look up terms that they didn't know, because we didn't want to actually I would call it disable people by not having them used to seeing terms that they would see other places and then knowing what those terms mean by taking it down to the 3rd grade level. So that's why we kept everything at the 6th grade level. And though everything was manualized, we also wanted to make sure that people had handouts that were 1-page, easy to use tips around managing your digital identity, for example, so that you don't have to go through the whole manual and find out what's there, but you can just have this 1 page that you can stick up on the fridge or stick in a notebook and have it easily accessible to you. And I think we were just talking about this previously. I think Karen brought it up around telehealth etiquette. One of the things that when COVID hit and we were doing this work primarily via Zoom, we were doing it previously in person, but when telehealth hit, we had to shift to doing it via Zoom or another kind of platform, maybe Teams, I think they were also using. But what we were finding with the expansion and use of telehealth, since everything had to shut down, is that even though people knew how to use their technology, they weren't kind of thinking about how to show up for that telehealth appointment or how to show up for the teleservice appointment. So for example, if people were living in congregate settings and the only place they could have privacy was in the bathroom, so they would go in the bathroom and shut the door, which is, okay, that is a great way to go and get some privacy. But they would go in the bathroom and use the bathroom while they were having the telehealth appointment, while they were on camera. No. So we really had to help people think about, great, you did this right thing. You went to get some privacy. You were using your headset. You went into the bathroom. You're using that shower curtain as a backdrop. Make sure the toilet seat is down. If you're sitting on the toilet seat, don't be using it, right? Don't be going through the drive-through McDonald's while you're having your appointment. Those kind of things we call telehealth etiquette, to help people think through some of the sticky situations they might be in and how to address kind of their privacy, as well as how to think about having the least amount of distraction. Thinking about attending an appointment, just as if you were in person. If you were in person, would you be in the bathroom using the bathroom? No, of course you wouldn't. So don't do it when you're on a telehealth appointment. Just helping people think through, even though we're in the comfortableness possibly of our own home, how do we make sure that we are still having the least amount of distractions, most privacy, and showing up in a way that we can fully participate. So I think I was telling you a little bit about this DOORS program. And so here on this slide, you all will actually have access to the DOORS program. The link to it is in the notes part, I think, of the slide. And the program that I was showing you, which was done by Painted Brain in Los Angeles, unfortunately is not publicly available. Certainly people can contact Painted Brain and get more information about it. But it was based off of this digital psychiatry program at Beth Israel, and it has a number of modules. I think it has a little bit more modules than a Painted Brain has, and they're all available online and free to people. One of the things people have to think about when they're signing up for it is you do have to sign up for it. You do have to put some information about yourself in it, and it runs kind of like a learning net where you can keep track of the different courses that you've taken. These courses are all done via video. You do a little pre and post survey about what you might know about the particular module to see after you take the module, were you able to get more information. I think the difference, of course, of doing this in person with the people we serve is that we also did appy hours, which was a way for people to actually hands-on with a peer, test drive and ask questions about the material they were learning and using some of the applications along with the peers. The other thing that we did, oh, right, okay, so sorry, I'm skipping around. So the other thing is when we did this at the state level in California, it's called Help at Hand. And actually there are a video series through the Help at Hand website on terms, safety, phishing, scamming, things like that. You can see using public Wi-Fi, and anybody can access these, even though it's, is based off of a California Mental Health Services Act funding. It is open to the public. So one of the things that we found out as we were working on some of this technology work in Los Angeles in particular was that some of the providers actually didn't know much about how to use the technology. So it was very interesting that some of the peers, the certified peer specialists or peer specialists, we call tech peers, were also helping the providers to use the technology. Providers also helped us have a better understanding of where they were struggling with helping the people they were serving with the technology. As a matter of fact, they wanted to give up partially on using telehealth services for folks because a lot of, for example, the psychiatrists were spending so much time trying to help people connect to telehealth and use it, that's when we partnered to figure out where are you having issues, where can the peers come in and help, and how can we partner together. It was really powerful for the providers because they saw people with lived experience as having expertise in technology, when in general they may see peers or people with lived experience as the patient, as the client, as the person who needs help. And now it was shifted around where actually the providers were seeing the peers as the helpers, as the people who were helping them. So it really shifted their perspective around the abilities of people with lived experience, especially as they learned together and created opportunities to create especially the telehealth etiquette and telehealth and teleservices module of the curriculum. So I think we've talked a little bit about this as well. It's, build it and they will come, only if, right? Like you said, just because it's technology and a teleservice doesn't mean it's the right thing for the person, something that the person wants to engage in. If they're not going to engage in it, then, it really doesn't do its job. Also, one of the things we learned is that sometimes it serves a purpose for a period of time. It is not like medication that somebody has to be strictly adherent to forever and a day. And when I'm talking about adherent to, in this case, I'm really talking about maybe, a person wants to give doing a hope box a try. And so they learn how to develop that hope box, but then always being asked, are you using your hope box? Are you using your hope box? When it doesn't serve the purpose anymore, then that's okay. It doesn't serve the purpose anymore. What might be something else that they would want to try to move forward in their recovery journey? So building those trusting relationships means also being transparent about what is this technology? What does it do? What is the evidence about it? What is the evidence base around this technology? And how do we understand what data it's collecting and what people are doing with that data? The more transparent and honest we can be about it, the more folks will be trusting and be able to also engage. And then I think we've also talked a little bit about this as far as integrating and partnering with a co-design process, because one size doesn't fit all. So creating those opportunities to talk to the people you're serving about what are their expectations and hopes around using technology. Where might they need more support, or actually where might they need things like the actual platforms and the hardware and the software? And then how can we model these collaborative approaches so that we're all learning together and co-creating together? And I always say rinse and repeat, because if you do it once isn't enough. Kind of if you have to pivot, then you're going to have to do this again. Or if you find along the way, wow, that didn't really work out the way that we wanted, then it would be, okay, well, let's try this again and see if we can get a better outcome from that. Okay, so I'm going to turn it over to, I'm not quite sure who's next, so I will turn it over to, to the next person on our panel. Thank you.
Thank you, Karis, and thank you to Sheila and Karen also, who presented. I'm going to just walk us through a couple of transition slides before handing it over to Mike Chappell. So in a couple of minutes, we're going to transfer over to the discussion group portion of this event. And if you'd like to stay for the discussion, and if you haven't done so already, please continue to use the Q&A pod to type in your questions to the panelists. We will be covering as many of your questions as we can in the time remaining. Before we move over to the discussion, we'd like to provide an opportunity for folks to get their certificate if they would like to download that. So in a couple of minutes, you should see a file transfer box pop up on your screen. Go ahead and click the file name that you see in the list, and it should you should see it highlighted, and then you can click the download button, and that should start the process for downloading the document directly to your computer. I'd also like to just notify folks of a couple of webinars we have coming up next month, including part 3 of this virtual learning community. So if you'd like to sign up for any of those, please check out our listserv, and the announcements are sent out via the listserv on a regular basis, as well as many of our other events. Here is the website that you can go to register to receive our announcements if you are not already subscribed. And I would just like to thank everyone for who did take part in the webinar. There's some contact information here where you can contact SAMHSA's Gain Center if you have any follow-up questions or feedback for anyone at the Gain Center. Feel free to contact us here. And so now, for those of you who would like to stay on the line, we will be moving over to the discussion group. You don't have to do anything. You're now here in the discussion group, and I am going to turn it over to Dr. Mike Chappell, who will be leading the conversation for the time remaining. Mike.
Thank you, Erica. Hello, everyone. Especially like to thank Sheila, Karen, and Karis for really interesting presentations that kind of reinforced very similar messages. I think one of the most interesting aspects of all this, and you heard it through each of the presenters, was that, you know, COVID-19 didn't allow anybody the chance to prepare for this transition. It didn't allow court practitioners or clients to prepare. We really just sort of did it because we have to do it. And now much of the focus of our presentation and our thoughts going forward about what teleservices are going to look like in the future are really trying to encourage that opportunity to prepare and to do it right. And obviously we're sort of in the midst of it in many regards, so that, you know, may seem kind of complicated or confusing to folks. You know, where do we pick up those efforts? I wanted to ask a couple of questions. Again, if you have any questions, Erica's mentioned this, please put them in the Q&A and we should be able to get to them. If you've submitted a question somewhere else, like in the chat or privately to a facilitator, I don't see them, and I'm not going to address them because I can't see them. So if you did, just reinsert it in the Q&A box and we'll be sure to get to it. I wanted to kind of start with a question for both Sheila and Karen, and Karis, it probably will apply to you in terms of preparation as well. But, you know, we went over a lot of the details in Sheila's presentation about preparing for teleservices, assessing for organizational readiness, in Karen's presentation about client readiness, and in Karis's presentation about some of the training needs around digital health literacy and some of the preparation. And in the particular case of client readiness, assessing client readiness and organizational readiness, I'm sure a lot of people are wondering, we've heard this in other arenas as we have this discussion. Is there anything out there? I mean, we talked about all the various parameters and considerations, but is there anything out there? Is there anything being developed in the way of a formal assessment around client readiness or organizational readiness that we think is going to be available? Otherwise, you know, what advice would we offer to programs as they try to piece together those considerations around readiness?
I'd probably defer to Karen at first, just because I know she's recently done statewide strategic planning on teleservices with Montana and went through some of these things. So if you want to maybe start off, Karen, and then I can add.
Yeah, absolutely. Mike, that's a great question. From the center standpoint, you know, Sheila mentioned we have a research department and we do lots of needs assessment and strategic planning. We don't try to reinvent the wheel, but we haven't actually done a full publishing of the self-assessment tools and or readiness assessment tools that we've used for our jurisdictions. We tend to customize our surveys and needs assessments based on what the jurisdiction is asking us for. Some jurisdictions, specifically with teleservices, are more concerned with maybe interventions or broadband. It really depends on what we find out in the strategic plan, and then that helps us shape what we include in the readiness assessment, specifically from the client perspective. So the short answer is no, we haven't published an assessment specifically. We've had publications that talk about readiness and give some tips on things that are included in the same way I did in the presentation, but we haven't said here is a formal list of questions that you want to ask when you are preparing a readiness assessment for clients and or I would say programs. So thanks for the tips. I think it sounds like we need to do that.
Not necessarily your responsibility, but I'm just wondering what we knew of. But yeah, go ahead.
Yeah, I think there's some work out there from Maryland. It might be older around teleservices assessment guide. Again, I don't know how new it is, maybe from 2017 or so, if not earlier. And I know from the client side of it, or the person being served, the way that we did it was actually kind of using an old-fashioned Delphi process of bringing together stakeholder groups, again, kind of using those demographics to get information from stakeholder groups to figure out what we needed to focus on. And then that's how we sort of backed into it. So it was kind of a backwards process. Rather than using an assessment and then adjusting it, we actually created it from learning from the stakeholders first.
Great. Yeah, I mean, I think the presentation did talk about a lot of the different considerations, and I think to Karen's point, it's similar with a biopsychosocial assessment that you might do in clinical, you know, every program wants a form, they want a format, they want something that could be followed consistently so that no matter whom you're interacting with in terms of a client, they're all getting asked the same questions. But I think it certainly does need to be tailored in some realities to the local jurisdiction. There may be certain domains, if you will, that need to be more expansively covered due to you know, infrastructure issues that maybe are more prominent in one jurisdiction compared to another, where you have to delve a little bit deeper into that. So, I mean, I think if you're looking at the domains, you can probably piece together somewhere to start and then really build out from there, because as you start to implement it and more questions and gaps get noticed, you can sort of enhance that assessment. I mean, I have seen some teleservices assessments around technology access, but when it comes to clients, so there are courts that are using, you know, that are checking in with clients. Montana does it, and I'm sure other courts do it as well, that look at access to technology, but that's really just one piece of it. I mean, I think Karis mentioned it, and everyone else, I think, mentioned it, that clients may have all the access to technology in the world, but they may have a personal preference not to use technology for the services that they receive. And they may be able to do services in person. If they have a personal preference for not using technology and they have considerable barriers like transportation, employment, childcare, then it might be a negotiation. It might come down to a matter of what can you do to help them to get more comfortable with technology, explaining to them that this would greatly enhance their ability to engage and complete their requirements and get better. And so there are many considerations on both sides. And it's not going to be one size fits all, which makes it difficult. And I think we'll talk about that a little bit more in this practice. Did anybody else want to add anything to this this sort of? I know we all like standard assessments.
I'll just echo on.
Go ahead.
I would just echo on. I mean, I think a lot of times, you know, before this, yes, even when we were doing statewide work, we wouldn't just be like, okay, have every jurisdiction in your state start this. We would really encourage to, you know, pilot maybe in a rural area, in an urban area, so that there could be, you know, some takeaways from those that then would be more applicable to other areas. And I think also sometimes, you know, we know that somebody has already identified a specific service gap. And so then you're really able to Karen's point, really tailor a lot of these assessments, because teleservices really covers so much. And so you might have one area that, you know, one jurisdiction that really wants to focus specifically on, well, how do we make sure that this is an opportunity for an incentive for participants, and not just looking at, there's 8 million things for teleservices, so let's do a full assessment. I think, you know, a lot of times there's kind of that starting point where we can really have all of these considerations, but make it more specific to that specific need.
Great, thank you, Sheila.
And Mike, I just want to piggyback off of this too, because I think that that's a really interesting point. You mentioned Montana, and the work that we did in Montana was a big project. They wanted a statewide strategic plan for teleservices, and so we had to look at several areas in using teleservices, which made it a little bit tougher because, you know, if like to Sheila's point, if you're looking just for an intervention to fill a service, IOP service gap, right? That's so tailored that you can really dig deep in, find interventions that work that way, ask the clients about their training and their skills. It's a little bit easier to do. But when you're looking at doing a strategic plan statewide, you're talking about infrastructure, you're talking about technology, you're talking about equipment, you're talking about client training, client readiness, staff training, staff readiness, right? Implementation, marketing, all of these other pieces that go along with the teleservices initiative on a statewide level, versus just one element of, if Montana had come to us and said, we just want to market our teleservices initiatives better, you know, that assessment would look, you know, a certain way versus the multiple layers that we actually had to do in Montana.
Great, thank you. You know, this really raises an interesting question for me when I try to put myself in the shoes of, you know, treatment court providers. They're already doing this. They've been doing this for 15, 16 months now. Everybody has. Some have been doing it before that. But it's sort of an odd thing, right? Like, how do they slam on the brakes now and start thinking about appropriately planning for teleservices midstream? Like, Is it something you pick up with new clients? Is it something when, you know, any advice on that? I kind of constantly think about that. Like, you're in the midst of doing it, you're piecing it together. You've probably worked a lot out as you've kind of gone through the process. It was probably a little choppy at first. And any suggestions from the panel on just like where, when, how do you slam on the brakes and sort of go at this more intentionally?
I think one of the first things is really going to see, as far as billing, like when you're looking at regulations and certain things like that, how and when those change. I mean, I know even in certain states, like you can't go from county to county to get treatment. And so I think a lot of this initially is going to end up being where that lands as far as insurance and billing, because that's going to ultimately affect, you know, what they're even able to offer. And then I think after that, like, let's say things stay and people are able to bill the same way they have been now. I mean, I think that goes back to what's appropriate for the participant, right? To Karen's point, as far as individualizing, and like also just from the treatment provider's perspective, how has that person actually been engaged? And, you know, we always talk about individualized plans, but I think this is like a really almost another element of having that individualized plan for comfort level. I mean, I know we've heard pretty much across the board that for individual sessions, a lot of people were able to engage. I know especially with individuals that might be suffering from a lot of mental health issues and agoraphobia and other things like that, they were actually more present in some ways for these because they didn't have to deal with a lot of their other anxieties and fears and actually getting to the treatment provider. And so I think just weighing a lot of those factors is going to make a big difference on ultimately what works. Versus we also heard for, you know, if somebody was doing a group session, somebody's video goes out. And so it's like now everybody's not on kind of the same playing field. Also the engagement during groups and different things like that has been a lot more difficult. So I think there's already some lessons learned and takeaways that will able to be adapted going forward.
Yeah, I agree with Sheila. And I'm going to ask for a nickel for every time I say the word assess, because I've said it so many times today. But I don't think there's ever a bad time to assess or reassess. So as far as putting the brakes on a program, I don't know if that's necessary. But it's necessary to assess if what you're doing is working, and if it's not, what's not working, so that you're providing the clients with the best services for their recovery process. So if you haven't, and to be frank, I don't think a lot of programs either assessed or have reassessed, right? We were just kind of trying to survive. We were just trying to just get services to people in the best way we knew possible. So now is the time to maybe pump the brakes a little bit, not put the brakes on it, and then really assess, really have conversations with your stakeholders, your provider, the clients, to see what's working. And then that transitions you into the individualized treatment plans, because everybody was basically on teleservices, right? I mean, it wasn't another option, right? And so the concept that the swing of the pendulum tends to be is, okay, now we're back, you know, how many times have we heard back to normal, back to normal, back to normal? Like, back to normal is not normal. Like we have a new normal, and within this new normal, technology needs to be a necessity for some and not for others. And that's when the individualized treatment planning comes in. So I think really just taking stock and saying, okay, let's find out what worked, what didn't work, what challenges we had, what successes, what do we need to do differently, and then move forward from there. Because the clients will tell you, they'll give you the information. You know, Sheila mentioned Tara's study. You ask them, they will tell you. You include them,
They'll tell you.
They will tell you.
I think another piece too, on top of that, is that while you're doing this, that's my rinse and repeat, we'll call that the assessment. But, you know, while you're always looking at, is this working, the question that I had to ask when we looked at the data, which, you know, seemed to tell us, wow, look at all these people participating. And I began to ask, okay, now that we see that people maybe aren't missing appointments, for example, which was an issue. There's a lot of no-shows. Oh, wow, we don't have any no-shows anymore. And I'm like, well, great, or we have less no-shows. My question was, are people achieving whatever recovery goals they have for themselves? It's great, they're showing up for stuff, and maybe they even have more access to some of the providers than they've had in the past. Is that achieving something towards their recovery goals? If it's not, then what are we doing? Like, we're charging a lot of money, but we're not getting anywhere with it. And I get it's COVID time, and we're not, maybe some of the goals that people had set may need to shift or pivot, but we always should be looking at, if we're increasing the way in which people can access us using teleservices, are we also seeing some outcomes at the end? And the outcome shouldn't only be no-shows. All we were looking at is access and no-shows. That's not really a measure of recovery or that outcome for the person, that goal for the person. So I think that's really important to look at as well as they're doing that assessment. And to think about hybrid, yeah, everything isn't gonna, it might be easier and feel kind of cool. Ooh, yay, we can do teleservices. It's easier. We get to sit where we are and be able to provide it, and possibly it's easier for people. But again, thinking of it as hybrid, that technology is not going to be the answer. It is just one part of the larger equation.
Absolutely. That's
I
right.
just want to add on one other thing, which also goes into one of the questions, just as far as we saw pretty much across the board, a lot of people, we didn't have those no-shows. However, we were in the midst of, and still are, a global pandemic where in general people weren't really leaving their homes. They didn't have interactions with any other people, and so were they showing up for these things because they weren't doing anything else, and also just really seeking to have some type of interaction with one another. I think it's going to take quite a bit. I don't know how long, because I don't no one can predict, but I think it'll be when life goes back to being able to go in person for a lot of things and just see friends and family on a regular basis and stuff like that. If that's still the case, where people are still showing up, at the same rate, virtually or not, I think will just be something that time will tell.
Absolutely. And I think, we're sort of leaning into that question a little bit. So I'll go in that direction first, and then I will get to the other questions as well. There was a question about what type of time frame can we expect before we can reliably measure the effectiveness of teleservices. If we started teleservices due to the pandemic, how long post-implementation can we measure effectiveness in comparison to in-person live services? I think I would make a couple of points there, and then I'll pass it off to the panel. So teleservices in generally have been widely studied, not necessarily in treatment courts, but in the medical field, in telepsychiatry, in substance use treatment, and others. And the evidence base for teleservices is very strong. We presented some of that in part 1 of this series. And so there's a really good foundation for this. It has also been happening in treatment courts prior to the pandemic across the country, although hasn't been widely adopted, but it really hasn't been widely adopted in any service sector necessarily. So there is a strong foundation for this. There's a lot of evidence out there that teleservices are as effective as in-person services. There's nuances to all that research, but it's plentiful. And so that's something that we can use as a jumping off point. We shouldn't be necessarily too skeptical about it. Now, its implementation in treatment courts, Sheila makes an excellent point. Engagement was high in the sense of people showing up for appointments, but when everything is sort of back to normal, will that be the case? I think, it will take a couple of years. As Sheila said, we can't really predict, but I don't know that we can expect there to be massive studies of this done. We don't know what funding priorities will look like, but I think this does go back to the importance of sort of measuring things locally. And Sheila talked about that in her presentation in terms of what kind of outcomes can you monitor for the purposes of your court to start getting a really quick picture of the different metrics that you'd be interested in know. So what would it mean for it to work for your clients? And I think that's something to definitely think about. So I'll turn it over to the panel. And
Mike, if I can on this one.
Sure.
Hi, good afternoon. Victor Vasquez here. I think that the timing on effectiveness of teleservices and the measurement of its success or not can start being measured now. We've already been over a year in this utilizing. I know that it's been in existence prior to that, but most effectively and a little bit more in detail has been obviously through COVID. The measurements can start now. At least when I speak, it's on behalf of our court. When I say that at least 80% of our participants have only been serviced now virtually. So we can start seeing those effects of whether if it has been effective for them or not. And for the most part, it's the same individuals that we see coming back to court for sanctions or having difficulties. We've already kind of gathered the population in which teleservices is not for them. And we in whatever method we've kind of used or helped them with, they just don't feel comfortable with teleservices. For many others, and I want to say for more than half of them, it's great and it's worked out great. They've gotten used to it and they love it. And at least for our court, that's how we're looking at it in the future. Teleservices is the future. So I'd like to hear from the others whether if you might think otherwise and the effectiveness of it, if you've heard anything otherwise.
I mean, this is just me saying hybrid. Again, not to say teleservices is it and in-person is it. Again, at the end of the day, it's going to be what gets the outcomes that the person wants to achieve. And if it's teleservices, that's fine, and we should make it available to people and reduce any of the policy concerns that were lifted during COVID that may come back to haunt us and kind of shut everything down. That would not be good, right? So that's sort of my sense of it. I do get very concerned that sometimes what some people have concerns about is building skills around doing things in person. That sometimes the comfortability, if people have very, very high anxiety, whether it's social anxiety, et cetera, doing things in the comfortability of their own home via teleservices is amazing. And how do we build the skill to take that rapport that you're able to do, that relationship building you're able to do in a technological environment? How do we help them put that into in-person real life? So that's kind of where it's like, how do we have a both and versus an only, if that makes sense.
We support teleservices. I'll just say that. I mean, that's just the center. So as a matter of fact, I think that we all see the value in teleservices. I think when it comes to measuring the outcomes, it's going to be to Karis's point, what is it that you're trying to measure? What are you trying to achieve? And designing performance measures for teleservices initiatives is really important, because I'm going to say the F word, and the F word is funding. And if you have a data collection and you can show that this is something that you need, you can then request funding for it, and then make it sustainable. So I think it's really important to design a data collection system based on what you're trying to, whether it be from the treatment providers aspect, that X number of people completed the program successfully using technology. If it's from, monitor and evaluation piece, monitor and supervision piece, that you use, breathalyzers or what have you, and the clients, tested negative, or, what have, or they tested, they're testing positive, whatever the gaps in services that you need to have evaluated performance measures at each of those gaps, so that you can then use that information to improve your program, to modify your program, but also to try to get funding for your program.
Great. I mean,
Yeah,
I think
that just goes back, I think, for for that initial needs assessment, and not using it like in search of a problem when there wasn't one there to begin with. And so, being more thoughtful and how would you say that this is a success, right? Like if you're trying to sell this to somebody, well, what outcomes were you measuring before this, and what can you see for a difference? And there's obviously a lot of aspects for that, but I think, again, that's where it really comes into having a thoughtful process for how this is going to enhance your operations and not end up hindering.
Yeah, I think, what we're talking about is a thoughtful hybrid approach. And I know there's a question in there about how do we do hybrid? How do we offer hybrid? Well, I think we have to think about it along a spectrum. You're going to have some clients who may receive all of their services in person because they don't want to do virtual, or because they can do it in person and that's what they prefer to do. You're going to have some clients who do everything virtually because maybe they live 2-3 hours away and the court is serving individuals in counties across the state, and that's really the only way to engage those individuals. Or they have incredible amount of barriers in terms of a busy work schedule, or a combination of things. But I think most clients are going to receive both in-person and virtual services, using virtual services where appropriate. And so that's part of the assessment of what can the program offer and what can the client engage in that regard, what capacity do they have. And it's going to be, the balance is going to be different for everyone. So then the challenge becomes of how do you design a court program that allows for that kind of flexibility. And so if you start thinking about the different kind of services you can offer, maybe you have a docket that has 30 people on for a given day, and you have 17 of them in person in the court, and you have 13 of them on virtually because they're in other counties. Or maybe you're working with a treatment provider who offers in-person counseling and group or individual counseling, but they also do teleservices for those who can't go in person. They can engage virtually. So it's a really flexible model that has to be thought through. And I think the point is that you're using virtual services, as Sheila's often referenced, and I do the same thing, as a service extender. It's the ability to plug some of the gaps where they can't be plugged otherwise. So when the option is that they don't get it at all, or they can get it virtually, or they have the preference to engage that way, or they're later in the program and they don't need to be there in person, the court is comfortable with them participating remotely. There's many considerations that go into it. And I think what makes it challenging is that it requires that kind of flexibility and those kinds of contingencies and procedures and protocols and practices, because it's not like one particular service is going to be offered virtually for everyone. It's like each service probably is going to need to have in-person and virtual contingencies in place so that everybody can receive them. And there's no one size fits all model for any court, because each jurisdiction is different in terms of the services that they have access to. The clients are going to have different needs. And so there's no easy answer to that question. How do you do hybrid? It's sort of, how do you take into account all of these various considerations from a programmatic and client perspective to offer that kind of a flexible model?
Can we add one other thing to this that I don't think any of us have talked about? And that is the health and well-being of the staff who may end up having technology fatigue. And I think many of us who have not been on, using technology all day long on how many different Zoom, Team, WebEx, et cetera, meetings, and then being put into Zoom rooms and breakout rooms and coming back. And then it really is very taxing for the individual, both the service recipient who may be doing this in lots of different ways between court and school and et cetera, and also for the staff person who's delivering the service or supporting the person in the program. So I think it's really important to think about how to break that up so that a person doesn't have burnout or over fatigue because we're relying heavily on teleservices in that way. Again, not to say don't do it, but just to think about how do you provide those breaks, how do you, give people time to rest their eyes, and then take care of their wellness when we're using teleservices.
Excellent. Thank you, Karis. Karis, I was, I've been doing this work in teleservices for a long time, and certainly, noticed the sort of hecticness of the rapid transition to teleservices for pretty much everybody at the time of the pandemic. And I sort of what you were asked to do in coming on was talking about sort of some of the preparation needs and some of the training needs and things that we never had a chance to consider. And I was actually incredibly, I guess, surprised in some way, although not when I thought about it for a second, in terms of the digital health literacy curriculum that you put forward, how basic, how you start, you talked about really starting from the ground up. I mean, how to set up an email, a lot of things that we take for granted. I just, if you want to comment a little bit about that, more about that, I mean, even, like I said, someone like me, I kind of had failed to think about it at that level in many regards. And I think that's an important take home from this.
Yeah, it was really striking for us. Again, I think when we started thinking about expanding what we were doing with using technology, period, and then of course shifting because of COVID to expanding more telehealth and teleservices, it was people, it was the workforce that was saying, yeah, we need to do this because we use technology every day, all day, and probably every aspect of our lives. And we didn't really think about the service recipient and what they may have access to, how they understand it, how they use it. We thought everybody had, quote unquote, an Obama phone or one of the federal Lifeline phones, and everybody didn't. And if they did, some of them just had a flip phone. So, we were trying to think about, doing video only calls. You can't do it if you have a flip phone. So we really had to, and again, this might have been a little bit of a halt, but maybe it was more about, well, let's proceed and also kind of assess where are the people that we are going to be providing these services in their comfortability, their knowledge, their skills, their experience, and their confidence in using technology. If they don't have that, they're not going to use it. And so, and they may not have interest in it. And we thought also that older adults had no interest. Now we're not interested, we'll just use the phone, when in fact they did have interest. And so we actually took the 9 modules that are in the digital health literacy curriculum, work with older adults to find out which ones they really wanted to focus on. And there were only 4 that they felt that they really wanted more information and support with. So I think it's really critically important because some of the things where people are struggling, again, may not have anything to do with what we think. Like, if they're not showing up for something, we thought, oh, it's a transportation issue. Oh, well, they're just recalcitrant. Oh, they're non-compliant, et cetera, et cetera, et cetera. It was like, well, if you show me how to use my calendar, I'll probably remember. If you show me how to set the alarm on my phone with the calendar alert, I'll be more likely to remember I have an appointment and to show up for that appointment. What? I can set the alarm for travel time? I didn't know I could do that. I didn't know I could set it up that way. I mean, just some really basic stuff to help people overcome some of the barriers that were the real barriers, not the ones we thought, but the ones that were really existing for them using the technology. So it was pretty basic. I see somebody asked about what was a hope box, and hope boxes, if you have one in real life that you can pick up and touch and move around, is a box that has some of your favorite things in it to remind you of or help you during times of stress or depression, or if you want to reach for that cigarette or reach for some kind of substance that you shouldn't be reaching for, then what do you have in that box to help you? That's a hope box. And so we were helping people create a virtual hope box, which meant how do you do that on your phone using your camera, using your notes, using files, and using setting up albums, so that no matter where you are, you can have access to this hope box when you're struggling, whether you're at home, whether you're, at school, even if you're sitting in, court or your doctor's office and you're starting to feel anxious. Like for me, I like to look at my puppies. Okay. I like to look at dogs. I like to look at pictures of my dog. It does something with the serotonin that makes me feel better. So I can go into my album on my phone that's called Puppies, and I know immediately that's where, actually the album is called Hope Box, and within the album it's called Puppies. And I'll go to Puppies and I can start looking at puppy pictures and it'll make me feel better. So we help people do those sorts of things that there's no downloading of any app. It's the stuff that's native on their phone. So yeah, that's how we actually thought about just the digital literacy, and we added the word health because we wanted people to think about their digital footprint, their privacy, their security, understanding that, asking questions about it. How do you read the privacy policy, which are generally for a lot of these apps longer than 15 pages of 8.5 by 11 paper? How many swipes of a phone is that, right? So, but anyway, we really wanted people to participate using technology in healthy ways. So that's really what it was about too.
Thank you, Karis. That's very helpful. It's a really important take-home point in terms of the kind of support that you have to think about your clients might need. And you'll only know if you check in. I wanted to kind of come back a little bit to this notion of a hybrid approach, because I think it's important that folks be able to conceptualize it, or at least start to think about it. I had given the example of virtual court proceedings that might be able to be accessed by people in person and and remotely. You know, my understanding maybe to Sheila and Karen is that that's doable and has been done. And there may be other examples. I think when we think about hybrid models, you know, there's some courts that may talk about teleservices tracks. And sometimes the intimation there is that it's a small percentage of people that are getting all their services virtually. I think that maybe that might happen in some jurisdictions, but in reality, it requires a more flexible model that has people accessing the same services both ways. Can you talk a little bit more about that? Maybe expand upon the example I gave. If I misspoke, certainly correct me, and maybe give some other examples of how the hybrid model is materializing.
Yeah, I can talk about that a little bit, because we had that happen. You know, we referenced Montana because, you know, Montana was really at the forefront of using technology and teleservices, and they, in their court in Billings, they actually have a track. They call it a track, and it really is for clients who are probably, I'd say, 95% teleservices or remote, you know, whether someone is, you know, works on the railroad and then has to travel for work. And so they, you know, they do their AA meetings online, they do their treatment online, they do, you know, their court hearings online. But what Montana really built in is that there is some face-to-face contact with that individual. They do make space for that. So it's not 100% a teleservices track. And I think that that's just to the point of, you want some face-to-face engagement. And they accompany, they did graduations online. They do all of those things to really support the clients, to your point that they have clients from all over the state of Montana, which could be hours and hours away. What I'd like for the attendees to think about is, in our treatment courts, we have phases. And our phases are within the same track of our treatment courts. And we individualize our phases or goal set for each phase differently. And I want them to think about teleservices in the same way that, you know, a hybrid model is like a phase advancement or a different phase. What you do in phase 1, you may not do in phase 2 or phase 5. And you should be goal setting at each of those phases, whether it be face-to-face or teleservices. So if you think about it in the same way, it's not, maybe it seems like it's a lot more work to use technology or teleservices, but actually once you get the ball rolling, which we've all been doing, you will goal set in each area. So I think about it like phases, like, because here's, I guess my point is, if you're not goal setting at each phase of the program, teleservices and hybrid is going to be a little harder, but you should be goal setting differently at each phase of the program because the client's needs are different. So that's, I wanted to make that comparison. But yeah, to your point, Mike, what you said is absolutely right. You know, having remote check-ins with the judge, having remote check-ins with the probation or case manager, all of those things can be built into a hybrid model. And again, should be considered as the client's needs shift and progress, right? You don't want a client who is, that you know is really, really high risk, really, really high needs, brand new to your program, offering them a teleservices model if they're struggling in certain areas. Like, it shouldn't be just, hey, let's just do it. But if you have a client who is got a really good job, you know, and is working for a major corporation, and to keep that job, they need to travel, teleservices should be an option to help support that, because if they lose that employment, that's going to be detrimental to that person, their family, and their recovery. So I don't know if I actually answered the question, but.
Yeah, no, I think so. And in terms of, and some of my perspective, Karen, was thinking about like the challenge for the court or the practitioners to organize these options. And so, you know, my understanding is that, you know, if you have a docket for a treatment court on a Tuesday morning, you know, you can host that docket from 9 to 12, and you could have some people in person because they've identified as wanting to be there in person or needing to be there in person. And you can have some folks come in and participate via teleservices if they're 90 miles away or they're at work. And it's the same thing. You're muted when you're not called. You're in the background. You're watching it like you would be if you were in the courtroom, et cetera. And so that, you know, where it could get tricky is, you know, are you assessing everyone? Are there people who are in person who want to be there remotely and haven't been given that opportunity? Have you explained to them why not, if it's a decision of the court that they need to appear in person? Those types of things. But the court can definitely sit on the fence in that regard and accommodate both people in person and remotely without having to completely rearrange their existence, right?
Yeah, and I would just
Absolutely.
add. Oh, sorry, Karen.
I was just saying absolutely. I was just agreeing with Mike. Go ahead. I'm sorry.
I mean, I think also for some places that have been doing this, you know, pre-COVID, we used to work a lot in making sure as far as the equipment that's in the courtroom. And I know some places at this point have gotten these big kiosks where there's a large screen. And so, you know, everybody, the judge, the attorneys, the treatment court staff, all of them can see the individual. That person can also see everybody in the courtroom. So again, I think that goes back to go back to the basics. Right now, you might be just using a laptop, but going forward, what's the equipment you really should get to make sure that you can see everybody in the courtroom? And then as far as appearing, I mean, some places they might be appearing remotely, but they still need to log on and be there at 9 a.m. And they might have to sit there for, you know, 2 hours through the whole docket versus somebody that, you know, this is an incentive and they're in phase 3, they're able to appear and then log off right after, just like if they were in the courtroom and were able to be called first and not have to sit through it. So I think there's also benefits for people that are in person and seeing that and being like, oh, that person's in phase 3. Look at what they're able to do, like, and actually seeing that. So I think there's, I mean, yes, there are logistics to work out, but I think to Karen's point, if you're looking at it the same way that you do for the goal setting for each of the phases, I think it makes a lot more sense.
And Mike and Sheila, Karen, I agree with that. Also, kind of also using it as an incentive. You know, we have all these individuals that are participating. They're doing, they're being cooperative on their testing. They're coming out clean. They're attending their visits and their appointments as they should. So I think that keeping them on the radar just to make sure that they are complying, but then also using it as an incentive, having their office visits to continue to be virtually and make that push. I know that sometimes for us on the side of on the court side, it might feel like we're doing double the work at times. We're meeting with individuals both virtually and in person, but ultimately it'll be to the benefit of the participant. At least for us, we have many of our participants that have worked away, you know, because of all these jobs that are well-paying jobs in the oil field sector, or you know, with now the green energy stuff that's also kind of getting started here in Texas. So with all of that, those are good paying jobs. So we also need to consider that these teleservices need to be available for them, and we need to encourage them because they are very happy that they found this good paying job, and it's a big change not only for them but for their family and for their loved ones. So encouraging that also is great, but looking at ways where it's smart, it is a smart way of testing them. We've had a participant where they agreed to have the mobile device just so he can be compliant because he knew it was going to be working away at a far destination and not even in the county. So where would they go to a clinic to submit some kind of a test result of a urine analysis? So we always encourage that, and it's always also for their well-being, of course.
Great, thank you, Victor. Yeah, I mean, I think that's an important point. It's sometimes when we think about a hybrid model, we're trying to conceptualize it in a way where it's not double work. You're not doing double the, you're not holding multiple dockets. You're holding one docket. You're creating infrastructure to allow folks to get in virtually when they need to, or they've been identified as appropriate. And it's similar across the other types of services offered, using technology. And there is additional work in building some of that infrastructure, making sure it works properly, et cetera. But it can certainly be done in a flexible way that accommodates those who need that, and then others, appear in person. And it may change for individuals across the time of their participation. I want to be cognizant of the time. It's 3 o'clock on the dot right now. I want to thank again our presenters. Sheila, Karen, Karis, you were excellent. This was really helpful. I really hope everybody got a lot from this and will attend our third session on July 21st. We'll actually be focusing on and having some conversations around, actual considerations for implementation around court proceedings and treatment services that are delivered virtually. So you may be able to get a much better feel for what the hybrid model might look like in that respect. Thank you, everybody.
Thank you.
Thank you all.
Thank you.